Good afternoon, everyone. This is Dr. V again, right here with you. Today, I would want to discuss a little about the menstrual irregularities that everyone has been discussing in relation to the COVID vaccine. And a lot of queries have come to me as well for the same, and people are wondering if their menstrual symptoms, the irregularity, the profuse menses, uh, is happening because they have been around people who have been shedding after the COVID vaccine. Such cases are being reported, I have to say, but there is no conclusive evidence until now that whether this is directly related to that or not. I won't be able to substantiate that fact. But yes, I thought that we can always discuss remedies and homeopathic approach to the same symptoms that we are facing with respect to our cycles, the irregularity of the cycles. So in my videos, I try and keep the information limited to smaller remedies which have fewer symptoms and not the bigger remedies, because I am strongly against self-prescription of polycrest remedies, because according to me, they are extremely deep acting remedies, and they should not be taken randomly without proper indications for any symptoms whatsoever. So in this video also, I'll be discussing smaller remedies for the menstrual symptoms. The first remedy right here with me is Upion. I am not sure if you've heard about it. It is a rare remedy. It is a small remedy. It has, too soon and frequently occurring too much quantity of the flow, and there is leukorrhea after the flow, and there is also a lot of itching of the genitals in this remedy, along with this excessive menstrual flow. That is Upion for you. The next remedy I'm discussing here is Senecio Oryns. You must have heard about this remedy. It is commonly used. It is also indicated for irregular menses, but they are scanty. And they can also be too much. So there is no fixed quantity that we are looking at when we are talking about Senecio Oryns. But there is expected to be hemoptysis. Hemoptysis means that there is blood coming out of your lungs. You will notice such cases vomiting blood from their lungs or while coughing exactly at the time of their date, their cycle. So even that is covered by this remedy. And both the profuse quantity, too much quantity, and scanty, both are covered by this remedy. The next I would like to mention is Stannum metallicum. This is one remedy that amazes me every time I use it, with indications, of course. It has symptoms per se that says that the patient is very, in a lot of mental anguish or sadness before the menses. But as soon as the menses start, they start to feel better. That is Stannum metallicum for you. And Stannum, as everybody in our community knows this remedy to be characteristic of extreme weakness that is manifested along with other symptoms. So when you get such a presentation, we think of Stannum metallicum. The next remedy is a rare remedy again. It is called Tenesitum vulgaris. Tenesitum vulgaris. Again, menstrual irregularities of all kinds with intense nausea is covered by this remedy. And the flow is scanty, pale, watery, and causing irritation of the parts, of the private parts. The next remedy I would take up is millefolium. You must have heard it for hemorrhages in general. It is also a remedy that has too often and too much bleeding and too long as well, that the bleeding doesn't stop for days at end. And the bleeding occurs from the slightest exertion in millefolium. It also has severe painful menses, in which there are a lot of membranes of the uterus are discharged through the vagina. So we call this membranous dysmenorrhea. And so this kind of severe painful menses, which is lasting very long and is not stopping at its end, you can think of this remedy, millefolium. Trillium is another remedy that is similar to millefolium, but it has gushing bright red blood at the least motion. The patient feels as soon as she or he moves, as soon as she moves, there is a gushing of bright red blood, and that is trillium for you. Obviously, there are more symptoms. I cannot discuss all of them here, but I'm just trying to give you an overall idea that how do we work, with our hemorrhage diathesis patients. The next remedy here is Ustilago medis. This is again a remedy which has the uterus becomes very weak, and there is a persistent, there is an oozing, basically a passive oozing of dark brown fluid blood, very fluid, watery blood throughout the month in a case. Then we think of Ustilago medis. Hamorrhagic is a known remedy for hemorrhages. Again, there is passive dark blood which is oozing without pain and mostly in the daytime and not at night. That is Hamorrhagic. And one more remedy, lastly, I'll mention here, Kali nitricum. This is a good remedy when your blood it looks like ink. It's typical of that, ink-like blood. And again, it has too soon and too much flow, which is lasting for a short while. It doesn't last very long like Ustilago. It is not lasting continuously for days at end, but this would be for a short bout of, blood, which is ink-like blood. That is Kali nitricum for you. Thank you so much for listening to me. I hope I'll be able to answer all of your questions today. I'm right here with you on the group to answer your questions about this topic as well as others, if any. And all of you have a great day.